Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our regular Wednesday news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lementier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and Amarillo City Manager Jared Miller. We'll go ahead and turn it over to members of our panel to make a statement, and then we will take questions from our media members. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm doing well, Dave, and thank you. Hello, Amarillo. We have good news for you this morning on the panel, and I won't steal the thunder of people that are going to talk about our hospitalization rate, but I am going to just move to two messages off of that. We need everyone to continue doing what they're doing that's affecting our numbers in such a positive way. So I just want to be very clear this morning that we can't ease up. Yes, we have great vaccination rates and we're vaccinating thousands of people every day. And yes, our hospitals are better than they were 1st of December, end of November, but we're not at the finish line yet. So please, this little guy has got to continue to be your constant companion, wearing it even when you don't want to, because it's making a difference. And as you're planning your events, I know it's spring, I have many friends that are planning weddings and doing the kinds of events we like to look forward to in the spring, but we need for you to continue keeping COVID in mind so that you're planning your events with socially distanced parameters and just keeping in mind that we're not quite there yet. That really is the message yet. We're not quite there. We're doing so much better. And that means people's lives are being saved. That's really what it comes down to. But we're not quite there yet and we need to finish strong. But speaking of being strong, we got a nice shout out this week from the governor in his State of the State address. And I was so proud that he sees we're not only doing vaccinations well, both as a community and as a city and partnering in that, but we're also doing economic development well. And it speaks well of our city and of our entire region here in the Panhandle, that we have the grit and the flexibility to withstand a health pandemic and an economic crisis and still be performing, not just performing, but growing on an economic front. So I was very pleased with that. And if you're part of our small business community, part of our manufacturing, people who provide jobs and grow jobs in the community, I wanted to say thank you. This has been a hard year for you too, but your stability, your strength, your commitment to providing those jobs has been good for our community through the 2020 year, but it's going to be excellent for our community in the 21 year. So thank you for all that you do. And to each one of us who live in the Amarillo area, please keep wearing your masks. Thanks, Dave. That's all I have this morning.
Thank you, Mayor. Let's now go to Casey Stoughton, Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. Thank you so much. I'm glad to be here this morning. As far as numbers go, as of yesterday, we had a total of 32,331 total cases of COVID-19 here in Potter and Randall counties. In Potter County, we had 16,524 cases, and in Randall County, 15,807 cases. We do have a total of 29,322 recoveries, and we're up to 624 deaths here in our community. That leaves us with 2,385 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is down to 8%. We've stayed at 8% now for a couple of weeks. And the positivity rate at the drive-through testing center is down to 24%. The 5-day new positive case average is down to 97 new cases per day on average. And after being over that 15% threshold as defined by the GA32 governor's executive order as in an area of high hospitalization for over 100 days, our RACS hospitalization percentage has finally descended below the 15% mark. Yesterday, being day 6 of the 15 of those days that are under 15%, our percentage was at 12.85%. And that means that just over 12% of all hospitalized patients have COVID-19. If our RAC area, we're in RAC area A, if our RAC area stays below that 15% threshold for one more day, so today, and the state publishes data at 4 o'clock every day. So if our area stays under that 15% threshold today at 4 o'clock, then our area would no longer be considered an area of high hospitalization. And Mr. Miller, our city manager, will review those changes that will be in effect if in fact our area does stay under that 15% threshold. Locally, however, we're still in status level red. Today, we'll reissue another status level red, and that will be in effect for 2 weeks. And that is because 3 of the 4 indicators that we set several months ago as our threshold for status level red are still currently met. And you can find those indicators on the dashboard. That's talking about adult bed utilization, ICU utilization, ventilator capacity, and our 5-day new case average. And so 3 of those 4 indicators are still over the threshold for status level red. And while the status level red and the state's criteria for a high hospitalization don't necessarily track together, they do work nicely together. And so as we're looking forward to the ability to move around our community a bit more, and the pieces that Mr. Miller will explain in just a minute, it's really important to remember that our hospitalization rate, our infection rates are very fragile and depend much on our own behavior. And so that status level red, as we're in status level red for another 2 weeks, and we'll reevaluate that in 2 weeks, that reminds us as we're moving around the community that it's up to us as a community, that we're not out of the woods yet, that we still have to wear our masks, we still have to socially distance, we still have to wash our hands, and if we're sick, stay home. And that while our numbers are trending in the right direction, we still have a lot of work to do in this fight against COVID. And so I just could not appreciate our community more. I think that those 2 measures certainly work in tandem together. And so we're still in status level red, and we'll certainly continue to evaluate those indicators. But I just encourage everyone to, again, continue to wear your masks. As Ms. Nelson said, it's certainly our constant companion. And so it is weird when we get out of the car and we forget it and just run back to the car and put it back on. So it's just going to continue to be by our side for a while longer. As far as public health operations, the public health drive-through testing site does remain operational. And so if you need a COVID-19 test, please call the public health hotline at 378-6300, and our staff will screen and direct you to the test site. The outpatient bamlanivimab infusion center is still operational, and we have seen over 100 patients at that center, and so it's going very well. We still are taking referrals from local providers, and so if you have a patient who meets that EUA criteria, please refer your patients to us. On the vaccine front, we have given a lot of vaccine at the Civic Center Clinic, and we're thrilled to be giving vaccine. As of yesterday, we'd given a total of 29,855 first doses and 9,545 second doses, for a total of 39,400 doses. And that's out of the received 49,950 doses. So we still have a few doses left. We started the morning off with 2,145 new first doses, and then we're still giving those second doses for people who need their second dose. So check the date checker on AmarilloAlerts.com, and certainly remember to bring your card back that you received when you got your first shot, so that we can document your second shot, and so that you'll have your completed immunization record along with that completed protection. And that's all I have today, Dave. Thank you.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm good. Thank you, Dave. So all of these numbers are good. These numbers reflect decreasing prevalence in our community. And as we've all watched over the last several months, we watch these hospital numbers, and we'll get to hear a little bit more about that from Brian and Michael here in a little bit. As the others have said, we need to maintain our vigilance. You know, we were discussing a little bit before we came on the air about how difficult it is to treat hospitalized patients, and the treatments that we have for them. Although we've learned a whole lot, what we've also learned is once people become hospitalized, the treatments for them, including the remdesivir therapy, are very, very minimal in their effect. And so I think it's one other reason that we need to remain vigilant. Once people get hospitalized, there's really a significant risk that they're going to be there for a long time or death. So we want to try to avoid that. How do we avoid that? You know, the real home run here that we've been able to get in the last couple of months now is a vaccine, and we've been lucky, and we've been really fortunate to get vaccine, and we've had a good plan to try to get as many people vaccinated as possible. I think that's what we need to concentrate on. And also what we need to concentrate on is to continue our mitigation efforts. What are the mitigation efforts? We've talked about this many times. You need to wear a mask. You need to practice social distancing. You need to wash your hands. And so those are the things that are most important, especially as we remember that, in fact, we are going to be opening up here soon. And that's what we want. That's what we've been shooting for. So let's kind of remember to continue with those efforts. And that's all I have to say about that, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, morning, David. So I'm ecstatic. I'm ecstatic that we are on the 1 yard line to hit this magical moment of 7 days below 15%. So hopefully at 4 o'clock today, we'll be able to celebrate that 7th day. And you know, this is great for local business. I can tell you at the hospital here that we've been waiting for this moment to start talking about returning things really much more to normal at the hospital. So I'm hoping we can bring the furniture back into our front lobby. We've been talking about maybe loosening some of our visitation restrictions. And the biggest thing is I'm hoping we can get rid of those sterilely wrapped peanut butter and jelly sandwiches in the cafeteria. But overall, yeah, I think that the message today is critical, is what has gotten us here must continue to keep us here. Okay, so all the things the mayor and Dr. Milton talked about, the masks, the social distancing, the hand hygiene. And if you think about it, I've heard people say, well, you know, masks don't work. The amazing thing is if you look at our Northwest experience, I just checked again the lab this morning, we have had almost a zero occurrence of influenza or RSV in this hospital. And RSV is the virus that children get this time of year that can make them very sick. So clearly what we're doing to protect ourselves from COVID has done a wonderful job of keeping us safe from influenza and RSV. So again, we must continue what we're doing. You know, I think the most thing that I'm excited about is I'm looking forward to getting back to seeing some live music. So if we hit 4 o'clock today, I'm going to dust the dust off my amplifier and turn it back up to 11. All right, so we can start doing some playing. But the biggest thing is I know personally, I'm going to be drinking beer through a straw so I can keep my mask on in these different facilities. So I ask everyone to do the same because we have to keep our guard up in order to continue where we are right now. So let's talk about the Northwest numbers because I'm very excited about those. Today we have 40 COVID patients in the hospital. And that is the lowest since really the beginning of October. This puts us at 8.1% of our licensed beds. Fantastic. We continue to see that coming down. And right now we have 18 patients with COVID in the ICU. We've been able to move to a single ICU now in order to best care for these patients. So that's great. Right now, 13 of our 20 ventilators in use are going to patients with COVID-19 pneumonia. So still, you know, out of 18 patients in the ICU with COVID, 13 are on ventilators. But we were able to return 10 borrowed ventilators to the Regional Advisory Council earlier this week. And we greatly appreciate all the resources the RAC has provided for us, including those ventilators. But now we have the confidence to be able to return them, and they can mobilize them to places that need them more than us right now. Yesterday, we did about 170 COVID tests. We had a 3% positivity rate. Fantastic. Okay, that is the lowest positivity rate we have seen in many, many months. All right, and we continue to stay below 10% for about the last 3 weeks. We have only 18 of our staff are quarantined at the present time because of risky exposures or known COVID activity. So as Dr. Moulton said, all the numbers are looking in great direction. You know, the sad part is January has been called the month of highest mortality from COVID in this country. Now, at Northwest, we saw 51 individuals lose their life to COVID in January, and that's way too high. Now, that's better than November and December, where both those months we saw over 70 individuals die from COVID. So again, numbers trending down, but we've got to get way below where we are right now in terms of those folks who get sick enough to die in the hospital. Right now, the remdesivir, which is the inpatient medicine we're using, we've treated 701 patients. I'm looking forward to some insightful comments from Dr. Lamentier about BSA's observations on their experience with this drug, because we've been using it and using it heavily, but I think there's some interesting insight right now. And then the bamlanivimab, which is the outpatient monoclonal antibody we have 275 doses available. That's the one that is being given by the city downtown. If you are positive for COVID and you think you'd like to be considered for this drug, you have to go to your primary care doctor or your provider and let them do that referral to us so we make sure that you're appropriate for this antibody. Finally, we've been notified that we will see a demobilization of the visiting nurses, RTs, and other staff that have been with us for many months. And we anticipate losing up to about 50% of these RAC staff members over the next 6 weeks. Now, it's good and bad. They have done a great job for us. Okay? And the thing is that it's going to be hard to lose a lot of these folks. But there's also a good thing is that we need to get our staff stabilized again and get back to having our own staff take care of patients. But we do anticipate having about 50% of those folks leave and be demobilized to areas of the state that really need them more. That's all I have for today. Thank you so much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
Good morning. I'm doing well, David. Thank you. And good morning, Amarillo. I share our excitement today that we are starting to see things drop off in terms of our incidence of disease and our case numbers. I'm going to start off with some of our data, and then I'll get into a few other topics I want to briefly discuss. We're down to 46 patients hospitalized with COVID-19 today. We have not been that low since prior to October of last year, which is amazing that we are dropping to that low level, but despite battling COVID-19 now for the better part of a year and dealing with very high numbers in the fall, as we all recall. Of those 46 that are in the hospital currently, 17 of those are requiring ICU level care, and 11 of those COVID-19 positive patients are on the ventilator. We still have 54 total intensive care unit patients at BSA, but similar to Northwest, we have been able to scale back some of that expanded ICU capacity that we needed to generate in order to accommodate so many critical patients this past quarter. So again, good news there. And yes, we are dealing with now the collaboration with the state that we have to understand how the RAC nursing support and other staff beyond nursing is going to be demobilized in a planned fashion over the next 4 to 5 weeks. And we are going to work with the RAC to do that and the state to do that appropriately so that resources aren't being pulled away too quickly, and that we're very insightful about how that is going to occur. Our nursing leaders are going to help us with that piece along with our administrative teams. Right now, we're using very few ventilators of our total. We're down to 16 out of the 16 out of the 62 that we have total. We did give some of our ventilators that we had from the RAC back that we were able to utilize, and we're very grateful for that. Right now, if you look at just BSA's numbers, of our total COVID population makes up 15% of our total inpatient population and makes up only 10% of our licensed beds. And again, this 7 consecutive days for our trauma service area being less than 15% is fantastic. it's critical that we continue to do the things we've been doing with masking, distancing, being very diligent about hand washing so that we can remain in this zone and we can continue to proceed with those elective surgeries that have been pushed off for months, those procedures that are still important to get done for our patients and citizens of Amarillo that folks have been hesitant to come into the hospital about, thinking they could wait. And in some cases, they certainly can. But again, every time that we have to go into a situation where we're worried about disease incidence rising, we're going to be putting off some of those critical things that folks need to get done to have a better quality of life, depending upon what procedure it is we're talking about. So again, critical for us to remain diligent. I do want to say that, our experience at BSA for our entire Ardent Health System, which we have 30 hospitals across the country, we've had the greatest number of COVID inpatients. We've now had over 2,600 inpatients since the outset of the pandemic, which surpasses the next highest hospital in our system by about 1,000 encounters. And that is very significant. And when you have that number of patients, and being the scientists that we are, we like to look back and see what we've done and what type of data we've gathered when it comes to our treatments, the data that we're able to collate. And although it's not a controlled trial, we've looked at some things like our therapeutics. And one of our therapeutics that we've talked about a lot is remdesivir. That is the antiviral medication that has been shown in a prior study, specifically the ACT trial, to reduce the length of stay for patients treated with COVID-19 in the inpatient setting. But remember, this drug, when it first came out under the EUA, or early use authorization, was based on a phase 3 trial. And there was no evidence of a statistically significant mortality benefit, simply a length of stay benefit. Subsequent to that, there was additional data that came out of the World Health Organization that basically said, we're throwing a little bit of cold water on remdesivir because we're not convinced that the outcomes with this therapy are as brisk and beneficial as we think they were purported to be. So looking at our internal data, we looked at patients prior to the initiation of remdesivir back in the early part of the year, and then afterwards when we had this drug available. And interestingly, again, this is not a trial that was well done in terms of something that's randomized control, which is the ideal setting to determine the efficacy of a therapeutic, like a drug. We have not seen a benefit comparing, number one, mortality for those treated with versus not treated with remdesivir. We have not seen a length of stay benefit. We have not seen a benefit in terms of progression to mechanical ventilation. We also have not seen a benefit in terms of reduced number of ventilator days. So again, even though this isn't a trial that was conducted in the most appropriate format, when you're looking at your internal data, you're not seeing benefit in any of those aspects comparing pre and post, you need to scratch your head a little bit and make sure that you're understanding, going back to the original trials, what exactly was seen. And there's been a lot of scrutiny and discussion about multiple therapeutics since the outset of the pandemic. And I think the physicians and scientists are the first one to be able to say, look, this looks like it's effective, but we really need good data to say that we're going to put all of our weight behind something. So it doesn't mean we're abandoning the drug. I think we need to understand that there is still a potential benefit for folks based on the one randomized trial that was done well, to suggest that this may have a benefit to rapidity of recovery. So we're going to be very specific about how we administer it here, and that is working with our medical staff, leadership, and our pharmacy teams. We're going to make sure that our patients meet criteria to the T as outlined by the study. Because when we begin to extrapolate and go outside of a study, we start making assumptions that potentially are not accurate. So I want to just make that comment on that drug. Our physicians are going to continue to do a good job of deciding who is an appropriate candidate and if that person should be a individual receiving the therapeutic. In contrast to that, I think our next steps are to look at what our benefit has been from the monoclonal antibodies. Dr. Milton brought this question up today for us, but we're going to potentially start pulling data here that looks at how many of our patients treated ended up hospitalized. Anecdotally, it looks like it's been a very small number. So we'll start looking at that data. We are prescribing those drugs very vigorously. We've treated now about 430 patients with monoclonal antibodies. And again, all the data really has shown that for the therapeutics that we do have, the earlier we get treatment in place, the better. That goes for remdesivir if there is a benefit with length of stay. That goes for the monoclonal antibodies in terms of preventing progression to severe disease. And then the last thing I'll say in terms of additional comments would be the following. If you have an opportunity to get the vaccine, I want you to think long and hard about why you would not. Because again, if you get to the stage where you're requiring a therapeutic, whether it's a monoclonal antibody or whether it's now you're hospitalized and you need to be considered for another drug, this is us trying to treat something that we don't have good therapy for. So prevention is the best medicine. And that is get the vaccine if you have the opportunity to get it. Some of you I know want it, and it's not yet at the point where your designation gets it because of you're younger and healthier, for instance, as an example. But for those of you that are in the healthcare field, for those of you that meet criteria for 1B designation, I think you need to strongly consider the reasons why you would not. Because the benefits of vaccination, I think we're already starting to see. And I am convinced that that's part of the reason why we're seeing our numbers drop, is because some of the outstanding work done by our city in terms of vaccinating so many patients that have comorbidities that are higher risk for hospitalization. So again, I keep talking here. An additional thing I want to say is that our flu numbers are also down, as Dr. Weiss said. So masking does work. I can't remember a season where we've had such a low number of isolates into the month of February. Yes, we can have a late flu season, but we're seeing extremely low numbers of flu, extremely low numbers of RSV, which is the respiratory syncytial virus that typically affects the pediatric patient population the most. And it's got to be because of masking and social distancing and hand washing. So again, good news. We're very happy today to pass this message forward. And when you're listening to Jared talk about what we're going to be doing from the city standpoint, please pay careful attention to what we need to continue to do to keep our friends and our families in the community safe. Thank you.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Doing well, David. Thank you. So I want to talk real quick about our numbers. In our hospital right now, we only have 2 COVID positive patients. Neither one's in the ICU. They're both on our med surge. So my quick math says that we have 88 patients across the Amarillo community in the hospital with COVID positive. Now, I really don't know what we spiked at in the city of Amarillo, but I remember BSA reporting numbers around 200. And, Northwest is usually up there too. So this is a great news to see these numbers come down. But we know why these numbers came down. The numbers came down because we've been very vigilant about wearing our masks, doing our good hand hygiene, social distancing, staying home when we're feeling ill, and now the vaccine. And so all of us keep reiterating, just encourage everyone that despite whatever comes out at 4 o'clock today, that we continue those practices. Last week we had a veteran town hall, spoke to about 3,800 veterans across the Texas Panhandle and eastern New Mexico. And one thing that I just keep hearing is, when are we going to be able to get our vaccine out to those community-based clinics that we have in Dalhart, Childress, and Clovis? And so our team's working diligently. I think we're very close to having a plan we can put out there. And so the good news, it's out there. But one thing I want to tell our veterans here in Amarillo specifically is, we have vaccine. Please call, see if you're eligible to get it. We want to give it. I've actually had appointments go unfilled for vaccine, and that's really not what we want to happen. So please call. If we have appointments same day, we will give them out. And so talk to the team again about that this morning. Is, we don't want to have unfilled appointments. We want to give out all this vaccine we can. Today, we've given about 3,000 first doses to our employees and our veterans. We vaccinated about 12% of our veterans we take care of across our healthcare system. And so that's right on par with what the Amarillo community's done. And I appreciate the Amarillo City and the Lubbock communities, what they have done, because I know part of our veterans are going there and getting vaccinated for various reasons, but and that's only helping us as an overall community. Last thing I want to mention before we close out is today represents what is called the Four Chaplains Day. And the reason I mention this is the significance. Number one is I do want to highlight the work that chaplains bring to our hospitals, but especially these was honor 4 military chaplains who were on a Navy vessel in World War II. The SS Dorchester was a supply ship. They were working their way towards Europe. These 4 chaplains from different backgrounds, denominations, a Methodist, a Reformed church, a rabbi, and a Catholic priest had met in chaplain school, but they were on there and this ship got hit by a German U-boat torpedo. And so what did they do? They went and took care of the sailors. They helped sailors get off. They gave up their own life vests, their own protective gear for those sailors to get off. Now, 904 sailors were on this ship, only 230 survived. But the thing that came out of that was not all that. It was really about these 4 chaplains and all they did to bring comfort to those sailors at a time of need and how much they did. And there was the story of them linking arms as the ship went down and they went down with the ship. I will tell you is the military chaplains do a great thing. And so if you know a military veteran chaplain, please reach out to them on this symbolic day and just say thank you for what they do. And I want to just say thank you to our VA chaplains and the chaplains across all the healthcare communities. While we haven't faced a sinking ship, we have faced a different battle against COVID. And those chaplains are there to help that patient and that family as they are going through some very difficult times. And so just wanted to give a shout out to them. And last thing I'm going to say is stay vigilant, wear your mask, practice good hand hygiene, ensure you're doing social distancing, stay home if you're feeling ill, and get your COVID vaccine. Thank you.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
I'm good. Thank you, Dave. I wanted to echo what Dr. Gonzalez was saying about Navy chaplains. I worked very closely with a Navy chaplain while I was in the Navy, and his number one saying was God first, others second, self last. That's the character of those guys that Dr. Gonzalez was just talking about. All right. Because we are at a transitional stage very likely going from an area of high hospitalization to no longer being an area of high hospitalization, I'm going to go back into a little more detail on GA29 and GA32 today, because there are changes on GA32 specifically, and it bears reemphasizing GA29. Before I get to that though, the testing center is open. Our COVID-19 testing center is open. If you have symptoms you feel might be consistent with COVID-19, please call public health at 378-6300. They will screen you on the phone and refer you to the drive-through testing site. Also, the vaccination center is open at the Civic Center. If you're in categories 1A or 1B, both first and second shots are being administered right now. You can check AmarilloAlerts.com, and that will show you exactly what's available at any given moment, and we will update that in real time. If we run out of first shot vaccines, we will note that on there. We will still stay open for second shot vaccines, as Casey has said. Amarillo City Transit is providing free transportation for anybody wanting to go to either the testing site or the vaccination site. Just call 378-3095 and they will schedule transport for you both to and from the testing site. We want to make sure that transportation is not a barrier to someone getting tested or for sure for someone getting vaccinated. GA29 is the governor's executive order requiring face coverings when people are out and about. Every person in Texas shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it is not feasible to maintain 6 feet of social distancing from another person not in the same household. Generally speaking, when you're out and about, you need to be wearing your face coverings. This is what protects everyone that's around you. This is what protects all of us. There are some exceptions. Any person younger than 10 years of age, any person with a medical condition or disability that prevents wearing the face covering, any person with who is consuming food or drink or seated at a table in a restaurant to eat or drink, any person while the person is exercising outdoors and maintaining a safe social distance, any person while the person is driving alone or with passengers who are part of the same household as the driver, any person obtaining a service that requires temporary removal of the face covering for security surveillance, screening, or a need for specific access to the face, such as while visiting a bank or while obtaining a personal care service involving the face, but only to the extent necessary for the temporary removal. An example of this is at the airport. If you're flying, the TSA person checking your ID will also ask you to pull your face mask down to make sure your face masks, that you match your your ID that was provided. Also, any person who is actively providing or obtaining access to religious worship. And finally, any person while the person is giving a speech for a broadcast or to an audience. And we're also working under GA 32. And this is where most of our changes are going to take place, very likely tomorrow, again, if DSHS does confirm later today that we are still meeting the criteria for being under 15% of hospitalization rate. Once we go to under 15%, most of our businesses are going to expand from 50% capacity available to them to 75% capacity. There is no occupancy limit for essential services, religious services, local government operations, childcare services, public or private schools, drive-in concerts, movies, or similar events, and as well as the following establishments can operate with at least 6 feet of social distancing between workstations, and that includes cosmetology salons, hair salons, barbershops, nail salons and shops, and other similar establishments that operate with 6 feet of social distancing. All indoor, outdoor, professional, collegiate, and similar sporting events, including rodeos and equestrian events, are limited to 50% occupancy. And finally, one thing that is definitely going to change in both Potter and Randall counties is that a bar or similar establishment may offer on-premises services at up to 50% of the total listed occupancy if the bar or establishment is not in an area of high hospitalization, which will very likely change tomorrow. And the county judge of the county in which the bar or similar establishment is located files the requisite forms with the TABC. And my understanding is that both Potter and Randall counties will do that before tomorrow or by tomorrow. Now we also have, as we very likely will go into an area of not high tomorrow, we have made plans to significantly alter how the City of Amarillo is delivering services. While we were in an area of high hospitalization, we were doing everything we could, and we will still do that, to reduce the load on our hospitals. Part of that included restricting access to city facilities, providing a lot of services virtually, providing curbside services, et cetera, but not allowing a lot of people inside the facilities. And the purpose of that was to reduce face-to-face interactions for both our public and for our staff so that we can continue to provide services. Before I go into some detail on some outward-facing city facilities that work with citizens on a regular basis, I want to note that there is an expectation at all of our facilities that face coverings, social distancing, sanitization will be observed in all of our facilities for everyone in those facilities. So we understand if some people are not comfortable wearing a face covering. And so we have made accommodations to be able to make sure that we can provide all services virtually, over the phone, on the internet, and through curbside services. So we do still desperately want to service all the people, but if you're going to be working inside our buildings, interacting with our staff on a face-to-face basis, our expectation is for your safety and for ours, that you'll be wearing a face covering, social distancing, sanitizing, et cetera. At the City Hall, benefits, human resources, parks and recreation, utility billing, vital statistics will all welcome walk-in customers. All the other departments at City Hall are going to be accepting face-to-face meetings, but through appointment. The purpose for that is, or the reason for that is that the queuing areas, the waiting areas are not adequate to be able to accommodate a lot of people. So we do have to be able to schedule and manage the loading of those areas, especially of those waiting areas. The Sims building is, all departments will provide services by phone, email, in-person meetings by appointments are preferred, but walk-in customers will be accommodated. It could be that we will fill up our queuing areas and waiting areas and ask people to wait out in their car, and we'll come get them when the time comes and when their opportunity comes to meet with the person that they were wanting to meet with. All of those are going to be, there's somewhat some flexibility there, but we want to make sure that we can take care of everybody who wants to have a face-to-face meeting. We just might not be able to accommodate everyone in the waiting areas and still be able to social distance. Amarillo City Transit is continuing with our current operations. There is a requirement for face coverings there, and that goes beyond just the governor's face requirement, but also a federal requirement for all public transportation. Anybody on the bus is going to have to be wearing a face covering, and that's not something that we've promulgated. It's certainly something we agree with. Public health, ongoing expanded COVID-19 operations with immunizations are available by appointment only. So when I say immunizations are available, that's non-COVID immunizations. So the regular immunizations for school, for sporting events, things like that, those are done, still being done, appointment to be able to do those. Amarillo Public Library is open to the public on Thursday. Again, assuming that we maintain our below 15% hospitalization rate throughout. Service hours are Monday through Saturday, 9 a.m. to 6 p.m. locations. Curbside services will remain available for patrons who utilize it from 10 a.m. to 5 p.m. Monday through Saturday. Animal Management Welfare. The Animal Management and Welfare Department will be open to the public for animal adoptions and for the public to look for lost animals. The shelter will accept surrender of pets by appointment. Public access will be limited to 50% occupancy. Parks and Recreation, and this is a bit of a long one, but it is, I think, something that people are going to be very interested in. So I'm going to give you a pretty detailed explanation, and then I'll be wrapping up. Parks and Recreation will maintain operations with current augmented protective measures. That includes face coverings, distancing, sanitization, et cetera. Park reservations and rentals are allowed at up to 50% capacity. Restrooms will remain closed except at regional parks. Park amenities will reopen, including tennis courts, volleyball courts, et cetera. Athletics, field rentals are allowed. Leagues, tournaments at secured sites are allowed following the governor's orders. And a secured site is a site that has access control, like one of the baseball facilities, something like that. Leagues, tournaments at unsecured sites and indoor facilities will require departmental approval, just to make sure that we can, that the people operating the event and that city staff can work in concert to maintain compliance with the face covering, social distancing, sanitization, et cetera. Aquatics are open for general usage at 50% capacity. That's at the Warford Center. Rentals and reservations at 50% capacity. Our golf courses, our greens fee play, tea time tournaments, pro shop and dining areas are open at 50% capacity. Tennis is individual play. Leagues and tournaments are allowed following the governor's orders. The Warford Activity Center, I know we've already talked about aquatics. It's open for general usage. Programs are allowed at 50% capacity. Facility reservations and rentals are allowed at 50% capacity. All rooms are limited to 50% capacity. The zoo is open for general usage with indoor facilities limited to 50% capacity. Finally, the Amarillo Civic Center, events are resuming under current restrictions outlined in the executive orders. We also will have some space limitations because the vaccination center will still be operating as we reopen the Civic Center. So that means that the only areas that are really available for rental are the Grand Plaza, our theater, and in certain situations, especially in the evening, the Coliseum. Now, I want to close by talking about numerators and denominators. It's a bit of a math issue, so our doctors have hinted at it. But as we drive down the number of cases that are going to our hospitals, our numerator, the number of rooms available to service those cases, and how we calculate our hospitalization rate in our trauma service area is a math problem. So as we drive down that numerator, we have to be aware that our denominator is also going down at the same time as the RAC and as the state reallocate medical personnel that have been allocated to our area to other areas that are in much more dire circumstances. So those medical professionals are in desperate need in other areas. It is incumbent upon us as we go down to release those people to be able to help other areas. But what that means is that as our numerator goes down, our denominator is also going down. So our percentage, our hospitalization rate, that the denominator will affect our capacity at the hospitals. So our hospitalization rate, as our number of cases goes down, it might not go down as fast as what we would otherwise expect. So it's going to be very essential for everyone to remain diligent. I would say even to double down on your diligence of maintaining the face coverings, social distancing, sanitization, washing your hands, and I would also add getting the vaccinations. All of those things will help stem the spread and transmission of coronavirus. Dave, that's all I have, and I'll be happy to answer any questions.
Thank you, Jared. I'm now going to go to members of our media. Excuse me. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Kevin Welch of KFDA Channel 10. Kevin, how are you?
I'm good, Dave. Thank you. Casey, the vaccine supply seems to be more consistent than it was in the early days. Did we get like a really big shipment, or have just the smaller shipments been more consistent?
Yeah, that's a great question. The smaller shipments have been fairly consistent.
Okay. And how's demand at the Civic Center?
It kind of ebbs and flows. Yesterday and Monday and Tuesday were very, very busy. Today doesn't seem quite as busy, but we're still serving a lot of people. So it's been a good week.
Okay.
And I would also like to add that single week that we've received an allocation of vaccines, we have fully expended the vaccines that were allocated the previous week, well in advance of the end of talking about.
It just seems like there's a lot less red on the Amarillo alerts page than there was to begin with. So, Casey, can you tell me who besides city staff? I mean, I know there's lots of departments working at the clinic. Are there other entities represented there?
So we have city staff, and then we are also we do have a team of RAC nurses. So we have about 25 nurses who are provided to us by the state, and so we certainly appreciate them being a part of our team. They've been really great to work with, and so that's about 25 nurses that is augmenting our staff.
And I just want to add on how much we appreciate them. I mean, they're people that can actually put shots in arms, unlike the mayor, who all I can do is stand to say hello and empty the trash can or whatever else Casey says to do. But the state government made that possible by sending them, and they've been at our clinic basically since week 2, right, Casey?
Yes,
So
ma'am.
they've made a big difference in the volume of people that we can actually vaccinate every day. So we really appreciate the help from the state.
And Jared, remind me what could trigger putting us back in the high hospitalization?
One more time?
Is it one day over 15%, 7 days?
No, it needs to be 7 consecutive days over 15% to put us back into high hospitalization. So we might go over for 3, 4, 5, or even 6 days consecutively, but if we dip down again, it resets that clock.
Okay, that's everything. Thank all of you.
Thank you, Kevin. Let's now go to Gay and the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody.
I'm sorry, I think we just muted David. David, how are you?
Can y'all hear me now?
Yes, we can.
All right, perfect. So I guess my question, first off, for Dr. Lamentier, you spoke about this a little bit, but with the remdesivir data you were talking about, is that affecting how much the hospital uses that treatment, seeing that ultimately, in some cases, there's no benefit to it?
It certainly will moving forward. And what I mean is that based upon our current experience and based upon what we're failing to see as a significant benefit for those that were not treated with remdesivir versus those who have been, we're going to be very careful that we're only using the drug for the defined criteria that exactly meet the initial study that showed some benefit, and making sure that we're not prolonging courses of therapy, we're not initiating outside of that scope, and that folks don't meet some other type of potential contraindication. And you have to understand that there are scenarios where folks may have had some kidney insufficiency, et cetera, similar comorbidities that may have been a situation where we felt like the benefit maybe outweighed the risk. And although we didn't see an adverse event in those patients from utilizing the drug per se, the question is, did we get a benefit? So again, this is the constant evaluation we have to do when the therapies that come across and are potentially shown or reported to show some benefit, when we're not seeing that benefit in our own experience. I think we really have to be careful about the ongoing heavy utilization.
And Dr. Weiss, does that information also affect the way Northwest will consider using that treatment as well?
Yeah, well, David, I am certainly not opposed to stealing Dr. Lamentier's data. But yes, absolutely. I think the fact that he's raised this question, that they've done some really rigorous analysis of their experience, absolutely. I'm going to take this back to my team and have us look at our experience and also some of the more published data. And I'm with it. We need to use this stuff well and use it correctly. And so I'm glad the question's been raised and we're going to look at it.
Could I add something here? I'm an infectious disease doctor, and so there are other antiviral medications that have been out on the market for a long time, and one of those drugs is called acyclovir, and we occasionally use acyclovir in the hospital, and acyclovir also, that form of drug can come in tablet form. And there are viral infections, certain types of viral infections in the herpes family, being like chicken pox and herpes. And acyclovir also has kind of a blunting effect to it. It doesn't have a dramatic effect when people are severely ill with that. However, we do use it a lot, and so I think that when we're going to talk about these decisions of how much to use, I think we also need to keep in consideration other drugs that may be used in kind of a similar way, and the fact that we just don't have anything else to use either. So I think that it's always important to pull data and look at that, but I think we need to look at the whole scope of the problem too, and also other drugs that may be used in kind of a similar fashion.
Absolutely. Thank you for the clarification, Dr. Milton. Mr. Miller, I guess for my next question, you were talking about all the City of Amarillo services kind of being more open if the rate does not go above 15% today. What's the city's plan? I guess will the city, I guess, if the hospitalization rate goes up and can, I guess, the area becomes an area of high hospitalization once again, will it resort back to where it is right now with the city services?
Yeah, that would be the plan. One of the things that's good about the way the governor set up the plan in GA 32 with regard to how we move from high hospitalization to not high hospitalization, it's not something that's going to vacillate back and forth. Requiring 7 consecutive days. If we have 7 consecutive days above 15%, then we really do need to take aggressive steps to bring that back under control. So our expectation would be that if we do go back into an area of high hospitalization, we will move back into an operating posture like what we've been in the last few months. Now, we'll also say that we've done and people may disagree with me, I haven't heard that yet, but we've done an excellent job of continuing to maintain full service levels while restricting all of our face-to-face meetings. So we would continue to do that. We're going to do everything we can to maintain customer service if that happens, but we would go into a more managed operating environment where we're restricting face-to-face interactions and making sure that customers are as safe as they can be.
And just to follow up on that, will that, I guess, happen if the area turns into an area of high hospitalization once again, or if the area looks like it's trending towards that direction and may not have hit that threshold yet?
No, we will not go back into that most restricted posture that we've been in for the last few months unless we went into an area of high hospitalization again. Our current posture, the changes that we're saying right here only acknowledge the fact that we're moving out of an area of high hospitalization. Our hospitals are in better condition. We still are recognizing that we are in under condition red. So we do still have some modifications to operations. We're just opening up in a very gradual and managed way that recognizes the change from high hospitalization to not high hospitalization. We're still recognizing their condition red and taking appropriate steps to keep people safe when they come to city facilities to get services.
Absolutely. I guess the last question that I have is for the hospitals. What are those conversations surrounding visitation, surrounding, I guess, waiting rooms, getting back to normal? Does that also depend on the city's status level red, or does it depend solely on the area of high hospitalization rate determined by the Texas Department of State Health Services?
Yeah, David, right. So I would say we had kind of set that 15% as kind of the point that we would start those discussions. So we have an incident command in terms of that's our leadership meeting over COVID every week on Thursday afternoon. So that'll be a big part of our discussion tomorrow afternoon is, okay, we've hit this point, or hopefully we've hit this point by tomorrow. And then what do we need to do to look at every variable that needs to be considered before we start changing what we've been doing up to this point?
Yeah, it's the same at BSA. Those are certainly I would say some of the first thresholds we want to make sure that we're understanding, we're meeting. But then there are other factors that we're going to look at, based upon current hospital census, based upon what we think is going to be a mitigated risk for our staff, for our patients. So there's more than simply the threshold that has us determine whether or not visitation is going to be partially restricted.
Absolutely. That's all the questions I have. Have a good rest of your week, everybody.
Thank you, David. Let's now go to Morgan Durden of KV7. Morgan, how are you today?
Hi, good, Dave. How are you?
Good, thank you.
My first question is just about the, before these 6 days, we have not been under the 15% hospitalization for over 100 days. Can that trend, that downward trend we are seeing, really be attributed to vaccinations in our community?
Well, I would say that vaccinations are starting to have an impact, and I believe that. There's other things, though, I think that have helped. I think that putting in the mask order and the fact that people were becoming more compliant with wearing a mask, I think is probably even more important. And then, unfortunately, we've had a whole lot of people have gotten infected. So I think it's several things.
Great. And then my second question, we are seeing some optimistic numbers that you guys have talked about for, regarding COVID. But we just got under the high hospitalization mark. It seems like the hospitals are finally getting a break, but they are going to be losing some resources and staff. So is there a concern that if we open up tomorrow, that the hospitalization rate is going to go back up and we're going to be stressed again?
Maureen's right. Absolutely. I think that's been the message across all the people here today is we cannot let our guard down. I mean, the reason we got here was because of a lot of what we've been doing. And if we stop doing the mask, we stop doing the social distancing, we stop, we're gonna go right back up, no doubt about it. And then my fear too is, as you talked about, we're losing resources. So if we start going back up, we may not be able to get those resources back because there's so many other parts of the state that are really dealing with a much larger surge than we are right now. So we have to be careful. I think that's been the message clear as day today from everyone on this meeting.
I would also add that there's a direct correlation to piggyback on what Dr. Milton said. There's a direct correlation between when we became much more diligent in wearing face coverings and when our numbers started trending down. Once we started that downward trend was almost virtually uninterrupted with the exception of a couple, hundredths of a percent move upward on a couple days. So there's a direct correlation there between face coverings and moving the numbers in the right direction. Also augmented by vaccinations and, as Dr. Milton said, people getting positive or getting coronavirus. But the whole reason we went through that whole math discussion was to highlight to people that just because we're no longer an area of high hospitalization doesn't mean we can let our guard down, because our hospital capacity because of required and necessary and appropriate drawdowns of staffing from the state to reallocate those people to other areas that are in worse condition, will cause our percentage, our hospitalization rate, to not go down as quickly as what we would expect. We have to maintain diligence with the face coverings, especially, but also the social distancing and all the other cleansing and vaccination and other things.
Great. And then just for clarification, the effect will take place immediately if it's under hospitalization. So tomorrow they will be able to open up. Correct. Okay. Thank you. That was all I had.
Thank you, Morgan. Let's now go to, if I'm not mistaken, Aaron Langston with KAMR Channel 4. Aaron, how are you? Let's try one more time. Aaron Langston of KAMR Channel 4. How are you today, Aaron? Try one more time. Aaron Langston of KAMR Channel 4. How are you today? Okay, I think that's all the questions we had from you. Aaron Langston, Channel 4, how are you?
Yeah, okay. I had some microphone issues.
Yeah, if you have some questions, go right ahead.
Alrighty. First off, with our numbers starting to go down, are we expecting maybe that our vaccine allocation might start going down with that?
No, sir, we don't have any indication that our allocations will change.
Alrighty. And as far as you said last week, if somebody tested positive and recovered, that you recommend 90 days before getting the vaccine. Is it the same for people who got the infusion treatment?
Yeah, so if they have one of the monoclonal antibodies, then they need to wait 90 days from that monoclonal antibody. They can defer vaccination if they have, if they've been ill with COVID. They can be vaccinated just as soon as they recover and are outside of that quarantine period, but they certainly can defer for about 90 days.
All righty. And the hospitals talked about them being notified of drawing back on the RAC staffing. Has the city clinic been notified that they could be losing some of that staffing soon?
No, we have not been notified that we will lose staff. There may be a change in staffing, but we have not been notified that that there will be a demobilization.
All righty, I think that'll work.
Thank you, Aaron. That concludes all the media members at this time. I want to thank all of our panel members who took the time out to participate today and to provide this information to the Amarillo community. This is David Henry. I'm Communications Manager for the City of Amarillo. We'll see everybody next week. Thank you.
Thank you, David.